Today I wanted to talk about indications or things you might have noticed that might make you wonder about the health of your gums. The last time you had dinner, have you noticed food starting to pack in between your teeth? I know for a lot of patients, the saying is, well, as you get older, you become long of tooth. That's not necessarily true, though. If you're starting to eat meals and find that you've got stuff stuck between all your teeth all the time, your gums are receding, and it could be a sign of bone loss as well. So if that's the case, that would be something that we could investigate and repair if necessary. Other things that you might look for, have you ever noticed any pink on your toothbrush when you're brushing or flossing your teeth, or is there any pink on the floss? If you see that, that's automatic an indication that you have an infection underneath the gum. An infection underneath the gum is not normal. It's just like if you were to wash your hands and your hands started bleeding, that would not be normal. You would certainly become anxious about that to some degree. If you're brushing and flossing and you notice pink on your toothbrush, or when you spit into the sink and you notice pink in the sink, that's an indication that you have an infection. So those are the two most common things that patients start to notice before they come and see me. They'll say, I was looking in the mirror the other day and I noticed that my teeth are starting to look a little longer. And so they might initially come in to see me because they're concerned about the cosmetic outcomes of having your teeth look longer, having gingival recession. And we can repair that with something called regeneration. And if it's just recession, we can repair that with something called a pinhole procedure, which is really minimally invasive and simple. So, and also, I guess a third thing that I have patients come in and ask me every now and then is they go, when I put my finger on this tooth or that tooth, I'm starting to notice that it's a little loose. I had some food packed between my teeth the other day. I was flossing, and I noticed that my tooth moved a little bit when I cleaned it out between my teeth. So mobility is an indication that you've actually had some bone loss around your teeth. And so that's another thing, that a warning sign, that if you come across that, then come and see me and let's evaluate, because we have treatments for all of these different types of complications, these types of problems, and we can repair that. Oddly enough, you would think, well, gum disease is limited to my mouth. But the real long-term risk, especially in my patient base, most of my patients that are coming to me for gum disease, you typically start getting gum disease in your 40s and up. And so they're a little bit older. But a key factor is when you develop gum disease, it raises the inflammation in your body. And so if you're a patient taking blood pressure medication, that total body inflammation that your gum disease creates raises your risk of a heart attack or stroke by 3 times. That's a really significant thing. And studies have shown that if you treat the gum disease, that total body inflammation goes down. So you actually lower your risk of having a heart attack or stroke. So diabetes. In Texas, diabetes is really common. Tons of patients have it, and most of the time it's adult onset. You get it later in life. And when you have gum disease, the inflammation created by your gum disease will actually raise your blood glucose. Typically, when we treat a patient who's got diabetes for their gum disease, their blood glucose within about 3 days drops 20 milligrams per deciliter. And so if you're someone with diabetes and you measure your blood glucose every day, that 20 milligrams per deciliter, that's a lot. That's a significant drop in blood sugar. In some cases, it's enough that you may not need to take medications anymore. So diabetes, arthritis. Gum disease has been linked to arthritis. And so not only does the inflammation of the gum disease create more inflammation in the joints, but the bacteria themselves, it's called dynamic equilibrium. The bacteria get into your bloodstream, and as they float around in your body and land on your joints, your immune system will attack that bacteria. That's called an Arthus reaction. But basically what it means is your immune system is attacking this bacteria in a joint, and it creates damage in that joint wherever it landed. So it can accelerate arthritis and make any existing arthritis worse. Other things that gum disease have been associated with are lung infections. Patients that end up having chronic sinus infections, chronic lung infections, gum disease, that same bacteria that causes gum disease causes those diseases as well. And actually, a really big thing that just came out in the last couple of months, men that have benign prostate enlargement. Did you know gum disease has been shown to accelerate the growth of the prostate? And treating gum disease can actually lower the inflammation. It won't necessarily make the prostate shrink, but it'll make it where the inflammation is not causing the prostate to grow any further. And that's a really key factor, because 1 in 2 men have a problem with their prostate as they age. And having gum disease accelerate that problem, that's something that's well worth treating.